cheeks and get rid of your frown lines anymore. Researchers say it could help fight depression. Right now, Botox is in phase 2 clinical trials for FDA approval, and experts say it has some promising results. Dr. Abid Malik is the vice president of the Department of Psychiatry at Orlando Health, and he joins us now to talk more about this. Now, for those who've been living under a rock, what exactly is Botox and what does it do on a regular basis?
All right. Well, Botox is actually the commercial name for botulinum toxin, which is produced by bacterium Clostridium botulinum and the related species. But it is also produced commercially for health reasons, cosmetic reasons, and for research purposes.
Now, most people know Botox when it comes to, for your eyes and wrinkles and that sort of thing. And also, recently, it's been used for people who have excessive sweat in their hands and feet, right? But now it's having an additional purpose of fighting depression. Explain.
Yes, I mean, Botox has several approvals, including approval for migraine, for example, and it is being tested for depression. So there are actually several studies already out which show some promising result when Botox is used for depression.
Now, how does it help fight depression?
Well, there are several different theories. One of the theory is that our brain sort of see how we feel based on our facial expressions. So when the Botox is injected into our face, so facial expressions are not necessarily sad. So mind reads that way that, okay, we're not feeling sad, so depression alleviates. So another theory is that the nerves in the face area where the Botox is usually injected somehow transmit message to the area of the brain which controls emotions and thus help us with the depression.
Okay, so at the end of the day, can anyone have Botox, or is it only certain people?
Well, Botox is approved for some other things, including migraine headaches. It's also given for cosmetic purposes. But when it comes to the depression, it is not yet approved by the FDA. So it is considered an experimental treatment for depression as of now. Mm-hmm. So only a few physicians and few centers around the country are using it on an experimental basis right now.
Okay, now are there any situations where you shouldn't use Botox?
Yes, I mean, there are certain conditions. If somebody is allergic to the Botox, or there's some hypersensitivities, or if somebody has some infection where the Botox is supposed to be injected. Sometimes urologists use it for some bladder issues. So for those people, they should not have urinary tract infection or urinary retention. Mm-hmm. So those are the conditions in which Botox should not be used.
Well, Dr. Malik, thank you so much for joining us. It seems we keep on finding out all the great uses that for Botox outside of for beauty. You have it for sweating, and now possibly for depression.
Oh, thank you so much.
Thanks for coming in.
Thank you so much.
Time now is 9:15. I take it over to Tom.